we brought our program, our healthcare partnership program, as our business focused program, and then school nursing program. We go to schools. We brought those to market at the end of 2020 and early 21, and they weren't fully baked. But we knew that if we did at least this amount of work, providing a significant amount of value, and as we developed those early relationships, we listened to our customers. We solved problems. We iterated quickly and effectively, and created. And we still do this. We're not done doing it. You're always doing it, right? But created, I would say, a best-in-class healthcare solution for our businesses and schools, and eventually our communities, across the state. But yeah, man, oh man, doing that work and financially supporting that, and building a team, and all the things. Wow, hard work.
So, can you tell me a little bit about the programs that you offer today? And I know that it's making an impact, but I'd love to hear maybe a couple stories of when you're talking back to clients, what they're saying that impact is from their perspective.
Yeah, so if we start on the business side, we go to businesses within the West Michigan community, Michigan as a whole now, and even some out-of-state clients that are starting. And when we go to an organization, and really they're being tasked with providing benefits, healthcare to their employees. They're working in an environment, the insurance environment, that's getting very unsustainable from a cost standpoint. And there's lots of reasons for that. So you have these businesses where health benefits as a line item is becoming one of the more expensive things. And I'm spending this much to pay my people, then I'm spending that much to provide them benefits. You're like, it's eating up my entire profitability as an organization. And businesses have to be profitable to succeed, to grow for all of us. And it's becoming a massive weight on their shoulders. So what we do is we come into an organization and say, we've created this healthcare delivery system that prevents people from using traditional healthcare because we're helping them be healthier, more productive, preventing disease, or reducing the exacerbations of that disease. We're also providing care that would have been done in a traditional setting, but at a much higher cost. So you think of a primary care visit. You go to your primary care doctor, right? And let's say you have an ear infection, a kiddo or something like that. You're getting billed a copay, which is, I don't know, 40, 50 bucks maybe. The doctor does their assessment. They might do a test or two. Total bills, 350, 400 bucks, which you then have a co-insurance component to, and then the insurance pays off of it. When the insurance pays, it's technically the business that's getting dinged on the back end for that. And a lot of people don't realize the financial dynamics of the insurance world. We can do that same visit free of charge to an individual, right? So you're not paying that 40 or 50 bucks yourself. The business isn't paying anything from an insurance claim standpoint. That claim's not even hitting the books. Practical. We can do that service on site for an employer. We do it virtually. We can even do some concierge work in the home. And so the value that provides and the access that can be is it's incredible. It saves money. It's way more efficient. It's relationship based, and we start developing these relationships with individuals to work with them on behavior, lifestyle changes, to educate and empower them to make the right decisions versus enslaving them in this sick based model. So we're providing value by reducing claims and need, and finding cheaper alternatives for care. And then we're preventing it altogether. And so huge value add on that business side. And like I said, we work with organizations now across the state, and just started supporting an organization in Illinois, which we're excited about. And hopefully we'll expand from there, and we see other opportunities shortly.
Do you have some examples or some stories about like before and after that you can share?
Yeah, we typically work with organizations who are in a self-funded insurance arrangement.
Okay.
So, self-funding is essentially likened to like an HSA plan, right? So you're looking to decrease your premium that you pay. You have then a higher deductible that you are responsible for, and then if something really bad happens, right, it kicks in beyond that. Business self-funding is similar to that, is that they pay fixed fees, they have a lot of money in the middle, and they pay for a catastrophic plan. We will go into an organization, and so our goal is to say we're going to pay for ourselves, if not 2 to 1 or 3 to 1 ROI based on our services. And so we've been working with many organizations now for 4+ years, and everybody knows healthcare is getting more expensive, right? You hear anything in the news right now, they're like utilization's going up. These health insurers are freaking out because they're like utilization's way out of the roof and healthcare is expensive and their loss ratios are going up and everybody's having a conniption about it. And we go in and as we do our work for these organizations, we're able to mitigate the cost increase. Healthcare by cost is going up by 6 to 8% a year and it's accelerating. Insurance costs are going up by, I mean, geez, some people are getting 30, 40% increases. It's wild. Many it's seeing 15% increases. And we're able to go in these organizations, some of the longest ones we've been working with, they've seen nearly zero increase in their healthcare spend over that 4 years, even a decrease in spend. So you look at trend, saying we've taken organizations who are growing and saying you can have budget predictability and savings within your healthcare spend but also provide an enhanced level of healthcare access and essentially concierge healthcare for your workforce and their families. It's a win-win-win, right?
Mm.
So it's creating sustainability for these businesses, predictability, and it's giving them something that they can recruit and retain with. So our goal is how do we make these businesses better, more financially sustainable so they can invest more in the products that they're producing and their people, but how do we make their people healthier so they can be better employees, right? So yeah, it's pretty rewarding work. Yeah.
I
Yeah.
imagine. I love it. And as you're looking towards the future and things that excite you about Health Bar and maybe your personal journey, your family journey, what are some of the things that excite you the most, looking out the next 5 years?
Yeah. I check myself throughout the business. You hit these phases of, like we've got over this hurdle, right?
A
And there's
ceiling of sorts.
there's a
Yeah.
ceiling. Yeah. You hit the ceiling and it's like, all right, what's the next ceiling?
Yep.
How do you break through it? And so we've progressively broken through those ceilings and leveled up. And we're seeing that we can perform our product very well in a regional level from like a state standpoint. We're testing how we can expand that model to multi-state now. So we've just kind of gotten into that. The way we do it, it's extremely cost effective and a business can go live with us for $0 essentially, right? So there's no big brick and mortar spend or large infrastructure. And so we found that our limiting factor is exposure, right? And for us, we've been intentional about just not blasting it. We're relationships, results. But I think the word's getting out a little bit, which is a good thing. But we're also seeing there's some national exposure. So we have opportunities popping up in California, in Texas, along the East Coast, and even some of those central states. And the challenge that I see is that we want to grow. We do not want to compromise our product because our product is about people and relationships and culture. And so how do we sustainably grow with a model that I think can have a national reach in maintaining how we do what we do and not falling into the traps of other healthcare companies that have bitten the insurance apple, right? We're a completely cash-based ecosystem, completely independent. The insurance model is lucrative though, right? We did an analysis one year, not last year, I think in 2023. And so this number would be much bigger now. But we said, how much extra revenue could we have gotten if we build insurance versus what we would build our clients, right? And our revenue would have gone up by $4 million if we had built insurance. And so we're saying no to that because that's the way the traditional system has worked. And that's the value we're providing back to our clients. And that's why we do what we do. So for us, it's not being tempted by those things, understanding why we're doing what we're doing, holding to our core values, hiring the right people, and growing responsibly. But do I think in 5 years we could be in 10 or 15 states working, maybe with some national partners? I do think it's possible, but it won't happen. It's going to compromise our work and our core values.